Hello, with this video, this marks the halfway point in our semester. Today, we are going to shift gears a little bit, whereas prior to this time, we've been talking primarily about ethical theory and that sort of thing. We are now going to shift gears and begin to talk about ethical issues. This actually is the more fun part of the semester, at least in my opinion, it's the more fun part of the semester. This is where we get to actually dig into issues that you and I probably have heard about, typically whether it be in the news, whether it be on like political debates, things like this. These are issues that we have heard a little bit of something about. Maybe we've talked to our friends over lunch or family members or something of that nature. But anyway, there are a number of issues that I've chosen for us to discuss. These come out of the book. They also are ones that I believe that are impactful even today, or have a bearing on how we live our lives even now. The first one of these issues, I thought I'd get us started off into an area that was not so controversial. Okay, I lied. The first of the issues that we'll be discussing and we'll look into is that of abortion. Ever since the January of 1973, since the Supreme Court handed down their decision in Roe versus Wade, which essentially overturned the laws across the nation, with the exception of a few states, all abortion laws, and it legalized abortion before 20 weeks, said basically that the states could not regulate abortion before that. Ever since then, there has been no shortage of debate, of discussion, of protesting, of cultural backlash on the issue of abortion. Here, even years and years later, almost 50 years later, abortion is still a hot button issue because of the emotions that the topic engenders. Now we're going to look at abortion in just a little bit. We're going to look at various positions that people take on abortion. But before we do that, I think it really is important on any ethical issue to make sure that whatever factual information that surrounds the issue, you should explore that first before delving into the morality of the issue. And that is because a lot of times the factual issues, when properly understood, the morality of the issue or lack thereof is going to be a lot more clear at the end of that. So we're going to look through some factual information that is relevant to the discussion about the morality of abortion prior to looking at the various positions of it. Okay, I think a good place to begin with that is with the definition of abortion. What is abortion? Well, abortion, simply put, is the termination of a pregnancy. The termination of a pregnancy is when a woman was pregnant, and in other words, there was an offspring growing inside of her womb, and for one reason or another, that pregnancy was terminated as the infant or the fetus, the embryo, whatever stage it was at, as it encountered demise, as it passed away, as it died. So a woman who is pregnant and she is no longer pregnant, that is known as an abortion. Now there are two basic types of abortion. Really, one of them only is the one that we'll really be talking about. Only one of them really has a morally problematic side to it. But I do want to make this distinction, and I'll explain why in just a moment. The first type of abortion that can take place is what's known as a spontaneous abortion. Spontaneous abortion. Now, a spontaneous abortion is when a pregnancy aborts naturally or as the result of an accident or something of that nature. Oftentimes, a spontaneous abortion is termed or phrased as a miscarriage. Okay, this is when a woman has no intention whatsoever of terminating her pregnancy, and yet for whatever reason, it could be an accident, it could be a genetic mismatch, it could just be a problem with the physiology of mom. There could be a number of reasons, but for whatever reason, the pregnancy no longer continues and it aborts itself. It's a natural thing. Now, most people would say that is a tragedy, but nobody really has a moral issue with miscarriage. Now, on the other hand, the other type of abortion, the other way that a pregnancy is ended, is what is known as an elective abortion. An elective abortion. And an elective abortion is when a person chooses to terminate a pregnancy through the use of chemical or surgical means. an elective abortion. This is when a woman is pregnant and she doesn't want to be pregnant for whatever reason. There are many reasons, which we'll see. But she doesn't want to be pregnant for whatever reason, and she elects to have someone or some process end her pregnancy. Now, throughout history, there have been many ways to do this, but now in the modern era, it's most normally done at the advice and the oversight of a physician, or at least a nurse practitioner. But an elective abortion is when a person chooses to terminate their pregnancy, to have it terminated. Now, this is the one that is morally problematic between the two, and the reason is because there is an act of volition that is included here. When we talk about spontaneous abortion, nobody has the woman who is having the miscarriage didn't desire to have that, or maybe she desired it, but she didn't choose to engage in activity that would bring about the end of her pregnancy. There was no choice involved, and where there's no choice involved, the morality of the morality of the act, or the circumstance rather, is it's not an issue. But in the case of an elective abortion, when a woman chooses to end her pregnancy, thereby killing the fetus inside of her, that is a choice that carries with it consequences, that carries with it significant ramifications of what you've done. So there are moral implications to that. Now, I bring this up because oftentimes in the debate, whether it's intentional or not, oftentimes in the debate, people from the pro-choice side, for example, will characterize people from the pro-life side as being against women who have had miscarriages. I remember when a little while back, it's been a number of years now, but one of the early times that I was teaching through this topic of abortion, I was having students do a debate on it, and the one who was pro-choice made the claim that since miscarriages are technically and medically referred to as abortions, if you are against abortion, then you are against women who have had miscarriages. Now, that's what they call a straw man argument in a debate. That's trying to redefine your opponent's position in a way that makes it easier for you to attack it, because her opponent, in fact, did not disagree with miscarriages, did not see them as morally problematic, had never argued against them, and that wasn't, in fact, her position. So anyway, I just wanted to make sure that you knew the distinction between the two, so that you don't make the same mistake of saying that miscarriages are abortion and that those are morally problematic, because nobody really thinks that. But those are two different types of abortion. So the next thing that we're going to be looking at are the stages of fetal development in the gestational period. This is human development from the time of conception until birth. And the reason we want to look at that is because this will become important later on in our discussion of the morality of abortion. One of the fundamental questions that people have to answer when it comes to deciding whether or not abortion is moral is the child alive inside the womb? Or better yet, does the fetus or the embryo, does it have moral value? If so, to what extent? And if not, why not? And how do you justify it one way or the other? So it does help us to look then at the stages of fetal development. This starts off with conception. This is the very earliest part in your life and in my life. Before conception, before the fertilization of a human egg with a human sperm, before that, human beings do not exist. Sperm cells exist, yes, but not every sperm cell goes on to be a human being. Egg cells exist, yes, but they don't have the potential to be a human being unless they're fertilized. And so neither of those, without the other, are what constitutes the whole being of a human being. But when conception happens, conception is when the egg is fertilized with the sperm. Then what you have is a zygote that is created, and a zygote is the entire being of a human being at a very, very early stage. And the zygote possesses 100% of the DNA of that individual. Now, it's at a very early stage of development, but that constitutes the entire being of that individual. And so, when sperm and egg meet, a zygote is created, and that is the very earliest stage of human development. That is at conception. Now, after that, there's the blastocyst. The blastocyst, and the blastocyst takes place. This literally means, it's a Latin term that literally means ball of cells, right? The blastocyst. The blastocyst is a stage that takes place between 7 to 10 days after fertilization. This ball of cells reaches the uterus, and at the very end of this stage, implantation occurs. Implantation is when the embryo, or the blastocyst, now called an embryo, it implants into the uterine wall so that it can receive sustenance from the mother, and it can continue developing. The embryonic stage takes place from the 2nd to 8 weeks of gestation. And it's during the embryonic stage that the embryo begins to develop what is known as sort of primitive tissues, what you might call stem cells. Stem cells are cells that are undifferentiated. What that means is that you and I have skin cells, we have liver cells, we have brain cells and blood cells and lung cells, and all of our cells serve a specific purpose within our body. Well, in the embryo, these stem cells are undifferentiated. They have not become specialized cells yet. But it's during this time, this time of embryonic time, that the embryo begins to develop these stem cells, which will later go on to become full-fledged organs and systems and this sort of thing within the fetus. That begins to happen toward the end of this embryonic period. So between week 2 and week 8, we have primitive tissue development. We have stem cells that begin to, at the very end of this stage, differentiate until we get to the fetal stage. Now, the fetal stage and the embryonic stage kind of overlap because by week 5, during the fetal stage, we have the development of a heart and an actual heartbeat. By week 5, between weeks 12 and 16. A process called quickening occurs, and this is during the fetal stage, if you will. Quickening is what that term refers to. Quickening is when a mother can feel the fetus move inside of her. I'm told that it's kind of like butterflies for some people. As the child develops within the womb of the mother, the child begins to kick and this sort of thing. Some are more vigorous than others, but they can always feel the motion of this child inside of them as it grows inside of them. That's known as quickening. Let's see, week 20. Week 20 in the fetal stage. Week 20 is the latest point at which the fetus can feel pain. This is a phase or a stage called sentience, meaning that the fetus can sense the things that are going on in the world around it. It can feel pain. It can sense pain. Sentience will become a criteria later on that people will look at as a way of measuring morality, and so it's important for us to know when can this child feel pain. From week 20 to 28. The fetus can live if delivered. This is referred to as viability. And we say week 20 to 28 because that refers really to the dating, the developmental dating that is sort of a best guess thing by doctors. The earliest that a child has been born and lived, I think on record as of the time of this recording, I think has been 22 weeks. A child that was born at 22 weeks gestationally actually has lived. That's come down. Used to being premature was a very, very difficult thing to get through. Now we have a lot of medical treatments. We have medical practices that can help children survive outside of the womb, even at a very premature age. But there are some stages of development that need to happen inside the womb because for example, if a child's lungs are not developed enough to take oxygen from the air, then it's not going to live outside the womb, no matter how good of medical treatment it gets. So that's the fetus. The fetal stage lasts from week 8 until birth. Birth usually occurs at week 40. This is obviously not every case is like that, but that is the stage of human development at which birth normally takes place. So we've got conception, we've got the blastocyst with implantation, we've got the embryo, we've got the fetus, we've got birth at week 40. So those are various stages of fetal development, and those will become important to concern ourselves with as we get more into this discussion, particularly as we get into the discussion of at what point does this fetus receive moral value, moral importance. All right, well, the next issue that we want to talk about are methods of abortion. How exactly do doctors go about performing an abortion in aborting a pregnancy? And as it turns out, there are many ways to do this, and the method that is employed generally is related to the age or the stage of development of the fetus. And so what we're going to do is start at the very earliest stages and the methods that are used there, and then we're going to get to later stages. The first form of abortion might come as a surprise. The first form of abortion is what is known commonly today as the morning after pill. This is also known as emergency contraception, or maybe by one of the trade names like Plan B or something of that nature. But this is the morning after pill. Now, I know that a lot of people would object to that. Well, wait a minute. The morning after pill is contraception. It's not abortion. It doesn't induce an abortion. If you're not familiar with it, the morning after pill is a pill that a woman takes if she has been sexually active and is afraid for some reason that she might be pregnant. Maybe the barrier method failed. Maybe she forgot to take her birth control. Maybe who knows what could have happened. But the morning after pill should be taken, I think it's within 72 hours of intercourse. And basically the way that this works is that it forces a woman's system to stall in its ovulation. So if a woman has been sexually active and she might be somewhere near ovulation, she takes the morning after pill in order to suppress that ovulation. Now, if it works in this way, it's what we call a contraceptive. And it's working as a contraceptive form of birth control. Contraceptive, if you break down the word, means against conception. And these are birth control methods that work primarily or exclusively to prohibit ovulation, or to prohibit the sperm and the egg from meeting. And of course, preventing ovulation is one way to do that. However, the secondary way that the morning after pill works is a little bit different, because what would happen if a woman is already ovulated and there's no way to suppress that ovulation, and she's been sexually active, and now the sperm and the egg are on their way to meet one another, or maybe they've already met, and the conception has already taken place. Well, the secondary or backup way in which this particular medication works, this pill works, is that it provides an environment in the woman's uterus that is inhospitable for implantation. And so, in other words, what normally implant or conception will take place in the fallopian tube, and then the blastocyst will travel down the length of the fallopian tube, come into the uterus, and then implant into the wall of the uterus, and that's where the embryo begins to grow. Well, the way that this works, though, is that if it doesn't prohibit ovulation, if ovulation has already taken place, and let's say that conception has already taken place too, and that blastocyst is traveling down the fallopian tube, it gets into the uterus, it looks for a place to put down roots so that it can start growing, but because of this pill, it cannot do that. Because of the hormones that are delivered to the woman through this medication, it can't find anywhere to put down roots. It can't get into the lining of the uterus, and so then what ends up happening is that that a blastocyst basically dies from lack of nutrients and is expelled from the body. Now, if the morning after pill works in this way, it's what we call an abortifacient form of birth control. There are contraceptive forms of birth control, and there are abortifacient methods of birth control. The abortifacient birth control are those that actually induce abortions. They actually will make the body get rid of a blastocyst, which is a child at the very earliest stages of development. So those are known as abortifacient. They induce abortions. And Plan B, or the morning after pill, is one of these methods of abortion. Now, it should be recognized also that many forms of birth control are also abortifacient. And for those who are engaged in sexual activity and they're using family planning methods and things like this, there are many forms of birth controls that are potentially abortifacient as well. One of the main ones that is prescribed now that follows this pattern is what is known as the intrauterine device, also known as the IUD. And the IUD, when it was very first on the market, it was a piece of copper that was inserted into the uterus in order to create that environment in the uterus that made implantation unlikely. Now, though, IUDs are typically made of plastic, and they also are combined with hormonal birth control medication that is sort of a slow release that accomplishes the same thing. It irritates the lining of the uterus. It also, in this case, because it's combined with the hormonal birth control, it also suppresses ovulation. But it is possible still that the IUD is abortifacient. In fact, any form of chemical birth control is potentially abortifacient. Whether it be the birth control pill, whether it be the shot, the implant, the patch, any form of chemical birth control is potentially abortifacient because it works, and they all work in the same basic way. They all basically are delivering hormones to the woman's body that basically cause her body to behave and act as though it were pregnant. And so it sort of at a very early stage of pregnancy. Well, when a woman is pregnant, her body prohibits or inhibits ovulation. It suppresses ovulation because it would be a catastrophe if a woman got pregnant with a child and then remained sexually active and then ovulated another month and then got pregnant with another child 1 month later. You would have, she could potentially have 8 or 9 children growing inside of her womb at various stages of development. That would be a disaster for both mom and baby. And so the human body prohibits or suppresses ovulation whenever a woman's body is pregnant. So if the hormonal birth control can fool her body into thinking that she's pregnant, she won't ovulate, and that's how the primary way in which they work. However, if they fail, they all also follow the same pattern as the morning after pill, and they create this inhospitable environment in the uterus so that the blastocyst cannot implant. And in that case, the birth control method becomes abortifacient. And if a woman is sexually active from 1 month to the next and she doesn't get pregnant, well, why didn't she get pregnant? Is it because the pill suppressed her ovulation, or is it because the pill aborted the blastocyst that was growing inside of her? Really, there's no way of knowing. It's just it could be either or. So anyway, the very earliest method of abortion would be the morning after pill. This Plan B, this emergency contraception. Now, moving on from there, for the first few weeks of pregnancy, the next form of abortion that is commonly used today is what is known as mifepristone. Mifepristone is a chemical that works after the woman is pregnant, or after the woman is already pregnant. And what it does, or how it works, is it suppresses the woman's body, her ability to maintain or continue the pregnancy. A woman develops a hormone during pregnancy that allows her body not to reject the pregnancy. So that the mom's body doesn't attack it and sort of flush it out. Mifepristone blocks that hormone that the woman's body creates, and so her body naturally attacks the pregnancy and rids itself of the pregnancy. This is normally a two-stage medication. The first one is the one that blocks the hormones. The second one is a contraction-inducing pill that makes her begin to deliver, and she will basically go through labor when she takes this pill. Trade name for this also is RU486. That's what it's also commonly known by. The next one, those are chemical forms of birth control. And the ones from here on out are going to be more of a surgical approach to abortive birth control. And so the first of that, or the very earliest stage of that, would be what is known as vacuum aspiration. Vacuum aspiration. And vacuum aspiration is where the woman goes in and her cervix is dilated, and it gets to a certain point, and then the abortionist can insert a vacuum suctioning device in through the cervix into the womb, and it suctions out the inside of the woman's uterus. This is an early stage of development. If the fetus grows too far after this, then it's not going to be able to fit down a vacuum tube, and it has to be dismembered. The next form is known as, well, your book calls it dilation and curettage, or a D&C, dilation and curettage. My wife is an OB/GYN labor and delivery nurse, and she tells me that's not actually what they refer to it as. They don't call it a D&C anymore. They call it a D&E, or a dilation and evacuation. But basically, the way that this works is that the dilation and the D&C, or the D&E, the cervix again is dilated, and a surgical instrument is inserted into the uterus first, and this could be a clamp, or a pair of tongs, or something. But the fetus is dismembered within the womb of the mother and pulled out piece by piece. And then this another tool is used to scrape the lining of the uterine wall, so that all of it is removed. You can't leave anything up in the uterus, because if you do, that can be very life-threatening to the mother later on. And so what they'll do oftentimes as they're doing this D&E is they pull the parts of the baby out. They'll lay it on a tray there and reassemble the body parts so that they can make sure that they got everything, so nothing gets left behind there. But that's a D&E or a D&C. The next method of abortion is what is known as a saline abortion. A saline abortion. And a saline abortion it's not used much anymore. This was pretty popular back in the 80s and early 90s as a method of abortion, but it's not used so much anymore. And the reason behind this is because it gave rise to an abnormal amount of live births. But a saline abortion is where saline or urea or some kind of other toxin is injected into the amniotic sac of that the fetus is growing in, and basically it kills the fetus by poisoning the fetus or burning it, because the fetus is there and it's growing and developing inside of the amniotic sac. Some people don't know this, but they inside the amniotic sac is a lot of water, or what's called water. It's a saline solution at a certain level. But the fetus that's inside of there is breathing this amniotic fluid. It's going inside the fetus, inside the baby's lungs. It's pretty much everywhere surrounding the baby. When you put the saline or the urea or whatever toxin it is that you're using in there, basically what that does is it burns. It acts like an acid inside of the amniotic sac. And of course, mom's not affected because the sac is there and that's protecting mom, but it's burning the child alive inside of the mother. And these babies, when they come out, they were given the nickname candy apple babies because they were just burned over every square inch of their body. Their skin was just charred red, and they would come out red, and they called them candy apple babies, sort of invoking grim humor there. But they would come out and they were dead. Now, oftentimes, though, they would come out and they weren't dead. The mom's body would just expel the fetus, and the fetus would be alive. And at that point, doctors had to face the decision: what do we do now? Do we use heroic measures to save the child? Do we allow the child to expire? Or in some cases, doctors ended the child's life outright by breaking its neck or putting it in a tub of water so that it drowned. One particular abortionist that was made a practice of doing this, his name was Kermit Gosnell, and he was arrested several years back, but he's in prison, federal prison now, because he was doing this. He would break the child's neck, or he would put it in a tub of water and drown it, or push scissors in the back of its head or something. And so he went to jail for that. Now, another form that often is used either by itself or in conjunction with these other methods is prostaglandin drugs. Prostaglandin drugs these are labor-inducing medications that mothers who are actually ready to deliver a child sometimes are given these medications. But in this case, this is if the abortion has been induced. If the saline abortion or something of that nature has been induced, then they've got to send mom into labor to get all of this out of her, and so that's just one of the safest ways to do it. So that's often used. Hysterotomy, also known as a C-section abortion. This is almost unheard of in the United States nowadays. But basically what has happened here is that this is, for whatever reason, if the child is too big, or if it's turned a certain way and cannot come out, the child is often, in this case, the child is delivered by C-section and either allowed to die or killed outright. In the last form that is used at a very late stage in the fetal development is known as a DNX, and this is where labor is induced and the fetus is delivered breech, which means they are feet first. They're delivered feet first, but then before the head is delivered, the doctor uses a suction device to insert and puncture the child's skull, suction out the brain of the child so that the head collapses, and then the child is pulled out the rest of the way. And removed from the birth canal. And the reason that it's done this way is because the law states once the child gets out, the child is under protection of law. But if the child's head is still in, then it's not considered to have been born yet. So that, and it makes it easier for the delivery to take place as well. So that's called a late-term abortion, also known as partial birth abortion. These were outlawed for a while, but there are several states that are, like New York, that are re-invoking them, that are utilizing them again and sort of, defying the federal government because there is a ban on partial birth abortion. Now, when we start talking about the morality of abortion, it's useful. Sometimes terminology is useful for identification purposes. And so you're going to hear me use the terms pro-life and pro-choice. Now, a little bit later on, we're going to delve a little bit more into detail and realize that those two terms are really insufficient for describing every position that people have on this topic, pro-life and pro-choice. But for right now, when I say pro-life, I'm talking about those who believe that abortion is immoral. And for the most part, they believe it to be that it should be illegal. On the other hand, pro-choice are those who believe that abortion is a moral choice, that you can have a moral abortion, and that abortion should be legal in general. They would say that. So pro-life and pro-choice. Now these are words or descriptors that these various sides invoke for themselves. So we'll just stay with that, and then we'll get to a little bit more of a detailed explanation in a moment. But the first thing I want to do when we're considering the morality of abortion is I just want us to see something. And so what we're going to look at is we're going to look at consequentialist arguments, either for the pro-choice side or for the pro-life side. Now, when I say consequentialist, understand what I mean are those arguments that depend upon the consequences in order to determine the morality of the abortion. So what consequences does this act produce? So for example, on the pro-choice side, it might be claimed that if this girl has this baby right now, she's too young for it. She needs to finish her education first. She needs to establish herself economically first before she can go ahead and have children and raise a family. And the argument goes that if she doesn't have this abortion, then it's going to negatively impact her life. Therefore, the abortion is morally justified, so she should be able to have the abortion. Now, notice that argument it focuses on the consequences of the action, the consequences of having the abortion, of not having the abortion, right? What's going to happen if? Now, on the other hand, the pro-life side might respond to that particular argument by saying, well, it's true that she doesn't have the education she needs right now, and it's true that she doesn't have the job that she wants right now. However, having a child has forced many a woman into maturity. It's forced them to grow up, and it was the bad decisions of youth that got them into the place where they are right now. But it would be making the right choice to choose life, and then raising this child, because you can go on and finish your education. You can go on and get a job if that's what you want to do, or have a career if that's what you want to do. Having this child won't necessarily make that impossible. It'll make it more difficult perhaps, but it won't make it impossible, and you will have started on your journey of making good life decisions in developing the maturity that is necessary for all of us, right? So the pro-life side would say, okay, that would be the consequence of having the child would actually be a good thing. It would impact your life in a positive way. So that would be a consequentialist argument. The pro-choice might say that, you know what, if we go ahead and if these women are not allowed to have an abortion, the more women that we have who are having these babies and it's negatively impacting their economic life, they're just going to end up being on welfare. So what we need to do is we need to let them have abortions so that we don't have welfare babies. But then the pro-life side would say, well, if a woman has an abortion, there is a psychological condition that sometimes results from abortion known as post-abortive syndrome, or PAS. And it's a well-documented fact that a woman who is post-abortive has less pleasure in life, or out of life, has more suicidal thoughts, sometimes can exhibit depression, and we're talking at a rate of about 600%. In other words, they're 6 times more likely to suffer these things than the women who got pregnant in a tough situation and went ahead and had the child. So the pro-life would say that, you know, a woman should not have an abortion because one of the consequences of having an abortion is post-abortive syndrome, this psychological condition. On the other side, there's the pro-life or the pro-choice argument, which would say, well, what about when pregnancies threaten the lives of the mothers or the health of the mother? Indeed, pregnancy sometimes can be threatening and can be dangerous to a woman, depending on her condition. If she has any sort of fragile health conditions or something like that, indeed, pregnancy can be taxing on a woman's health. On the other hand, it is a natural thing that goes along with what women's bodies do, and sometimes interrupting that natural process has its own set of consequences with it as well. But there can be situations where the life of the mother is pregnant, and the pro-choice side would say we need to allow abortion to be legal for those cases. On the other pro-life would say, well, there are good economic reasons to make abortion illegal, whereas the pro-choice side would say that you know, having these welfare babies is going to negatively impact the economy. Well, another thing that would negatively impact the economy is if there are not enough children who then become working adults, who then pay taxes and pay support into various things like insurance and Social Security and public assistance and all this stuff. If there are not enough people to do that, then the aging population actually, life is going to be much more difficult on them, because there's not going to be anybody to pay their Social Security check. There's not going to be anybody in these institutions that we have developed, which depend on there being a large group of working people, working class. They're going to collapse because we're shrinking that working class, and so with the aging of the boomers. Then that's going to having had an abortion through Gen X is going to negatively impact the economy that way. Well, what about the pro-choice side would say? Well, what about birth defects? Nobody wants to raise a child that's going to be severely handicapped. Nobody wants to have that child's life will also be impacted. We should be able to abort them before, as soon as we find out about that handicap, so as to prevent their suffering and the mom's suffering. The pro-life side would say, well, wait a second, what does that do to the public perception of the value of human life? Does that mean that life is only valuable if that my child's life is only valuable if I say it is? Or does my child's life have an intrinsic value of its own? Now, we usually assume the latter, because we prosecute parents for child abuse. And child abuse fundamentally is when a parent does not view their child as valuable, but we say that child's life has value inherently, and if a person abuses them, they will be punished for it. But if society starts devaluing human life, then what is going to essentially result from that is all kinds of human rights violations across the board for everyone. The pro-choice side would say, well, this keeps abortion safe. Because if you outlaw abortion, it's going to drive women to have back alley abortions, and those are unsafe abortions, and that will lead to many women dying or many women suffering complications. The pro-life says, well, look, no abortion is actually safe, because every abortion kills at least one person, and that would be the child that is aborted. And so there's no such thing as a safe abortion. And if abortion were outlawed, yes, women would go to the back alley. But right here, right now, if we understand that abortion is the taking of a human life, the fetus, shouldn't we make it dangerous and difficult for people to take human life? Isn't that what police do every day? They make it dangerous and difficult for people to murder other people. Should we not do that as well? And if a woman takes it upon herself to go in a back alley and have the abortion, it should be dangerous for her to take the life of her child. It should be difficult for her to take the life of her child. And besides that, there are many, many people who are waiting for infants to adopt. Whereas the foster system, they may not go to the foster system to adopt. There are many people on wait lists, sometimes for months, to have a newborn infant child of their own, and they would welcome these children into their family. So adoption is always an option. Now, we could go back and forth with these consequentialist arguments all day long. But what I wanted to try to point out is a couple of things. That number one, that there are many good reasons for that either side sees as good from their perspective, and but they're all of these reasons that I've listed so far are consequentialist. They're not the main reasons usually people are arguing with abortion, but these are some of the things that people bring up, some of the consequentialist considerations. Now, these reasons suffer the same difficulty as every other reason for every other consequentialist ethic, in reason that is given for a consequentialist ethic, and that is this. You really don't know before you engage in the act if what you're hoping to accomplish by the act will actually happen, if the consequences that you want to take place actually will take place. Now, to give you an example, one of the first reasons we mentioned here, is that the pro-choice side says, well, the girl's not ready, so she's either too young or she hasn't got her career yet, she's not economically ready, she couldn't raise a child, she's just a child herself, and all this stuff. Well, is that really true? If she has the child, is that child going to drive her to poverty and irresponsibility, continuing in poor lifestyle choices, or is that child is having that child going to produce maturity within her, as the pro-life person claims? Well, at the end of the day, you and I can't say one way or the other for sure, and that's because why? Well, it's because the act hasn't been done yet. Either the birth of the child or the abortion of the child. Neither of them have been done yet, and we won't know what the consequences are until we get on the other side of that. Like if she has the abortion, is she going to suffer post-abortive syndrome? Well, some women do, some women don't. We have no idea. If she has the child, it's threatening her health, is it really going to adversely affect her health, or could she make it through by undergoing treatment? And she'll come out fine on the other side. Well, we really don't know until after we've made the choice, and by the time that we've made the choice, it's too late. We've already committed ourselves one way or the other. And so, while consequentialist arguments might be offered in the situation of abortion, they aren't usually the main things that people are talking about. These are usually not the main considerations that people are talking about. Usually, the main considerations on the topic of abortion are deontological in nature. In other words, they concern themselves with talking about people's rights and people's obligations, people's duties. So they're deontological in nature. They're rights-based arguments, or they're duty-based arguments as well. Because if you remember, what is a right? We talked about this earlier in the course. How do you define what a right is? Well, a right is simply, a right is a claim that you have against other people that includes a freedom or liberty for yourself. And so if I have a right, then you have to let me have that right. My right entails an obligation for you. So if I have a right to my life, then you are obligated not to kill me. If I have the right to freedom of speech, then you're obligated to let me say what I want to say. You don't have to listen to it. You can walk away. You can ignore me. You can tune me out. But you have to let me say what I want to say, because I have the right to say. I have the right to freedom of speech. Now, the main arguments are deontological, and I'm going to generically classify these right now as pro-life and pro-choice. Later on, we're going to retool our phrase, though, our terminology. The pro-life argument mainly goes this way, and this is one whole side of the spectrum. Okay, one whole side of the spectrum basically reasons like this. Number one, all life has intrinsic value. Every human life has intrinsic value. Whether that life is a young life or an old life, a male or a female, a person who is 100% healthy and functioning, or a person who is disabled or in some way maybe has a terminal illness, whether a person is, regardless of what their culture is, regardless of what language they speak, whether they're rich or whether they're poor, all human life has intrinsic value. So that's number one on the pro-life side. Number two, the second phase of the argument goes like this. It says all living human beings have a natural right to life. Now what you see there is the word right. This person has a claim on others that obligates everyone else to protect that claim. And what is that claim? That claim is the right to life. They have a right to be allowed to live. In other words, you can do nothing. You are obligated to do nothing to bring about my demise. That you are obligated for that. So all human life has intrinsic value. Number two, all living human beings have a natural right to life. Number three, human life begins at conception. Human life begins at conception. It would be difficult to say that is not true, because the scientific, and not even invoking religion here at this point, but the scientific definition of life, a blastocyst, a zygote fulfills all of that, right? If you go down to any textbook, any high school textbook, any college textbook on the issue, and you see, what are the key things that make something living? You're going to see things like, a living thing consumes food, and it gives off waste, and it grows, and it develops. It reproduces. That's what a life is. And by reproduces, what we're talking about at the very cellular level is that it divides and it reproduces itself. So it is life. So if the zygote is life, if we found a fossilized zygote on the planet Mars, if our rover was driving around on the planet Mars and somehow found a rock that had a fossilized zygote in it, and it could see this, then the headlines all over the world the next day would say life found on Mars, because that is life. Now, so if the zygote is alive, if it fits the scientific definition of what constitutes life, then what kind of life is it? What is it? What kind of life is it? And as it turns out, that zygote is, number one, it has a full complement of human DNA, and number two, it has it is the entire being of the human at that stage of development. So because it has a full complement of human DNA, we can know that it's human. Because it's alive, we can know that it's alive, because it represents the entire being of that human being, of that individual at that stage of development. That is conclusively a human life. So human life begins at conception. Every single one of us went through that stage in our existence. That's number 3 on the pro-life side. Now, number 4 is this. Number 4 is elective abortion purposefully ends human life. Elective abortion purposefully ends human life. And that's what, if human life does begin at conception, if the zygote is human life, then abortion, which does get rid of a zygote or blastocyst or fetus, abortion does purposefully end human life. So that would be number 4. That would be their claim there. Number 5, murder is defined as purposefully ending human life without moral justification. Murder is defined as purposefully ending human life without moral justification. Therefore, abortion is murder. So abortion is murder because murder is defined as purposefully ending a human life. And what does an abortion do? Well, an abortion is when a mother contracts with a physician to end her pregnancy, which is by definition, a human life growing inside of the mom. So therefore, the pro-life side would say abortion is murder. Abortion is the purposefully ending of a human life without moral justification. Number 6, prohibitions against murder should be extended to all human beings, including the unborn. Now, there may be exceptions that would be morally justifiable, but for the most part, everybody on the spectrum of the pro-life side would say that prohibitions against murder should be extended to all humans. You should not be able to murder a zygote because a zygote is an innocent human life. So that's basically the deontological argument for the pro-life side. Basically, that human life is precious, that the child inside of the womb at whatever stage of development they're at is a human life, scientifically speaking. And that abortion brings about the end of a human life, and therefore prohibitions against murder should be extended to all acts that end human life at any stage of development. That's the pro-life side, and basically what they're saying is we have an obligation as individuals and as a society to observe a person's right to life and ensure it and guarantee it. That's the pro-life side. What you see here is that the pro-choice side begins in the exact same place as the pro-life side by stating that all human life has intrinsic value. All human life has intrinsic value. The next step where they go from there, though, is they believe that every human being, part of what it means to be human, every human being has a right to what they call bodily autonomy. Bodily autonomy. all human beings have the right to bodily autonomy. Essentially, what is meant by bodily autonomy is the idea that I have control over my body, that I have a sovereign ability to control what goes into my body, what I do with my body, and everything. If I want to get a tattoo, I can get a tattoo. That's bodily autonomy. If I want to eat a cheeseburger, I'll eat a cheeseburger. That's bodily autonomy. However, if I want to go work out and I want to get in shape, I can do that with my body. That's bodily autonomy. I should be able to do whatever I want with my own body, and everybody else should as well. So you do what you want to with your body, I'll do what I want to with my body, and so forth. That is the right that the pro-choice side argues that we have. We have the right to do whatever we want to with our own body. Now, after that, either the argument can go in one of two directions. After bodily autonomy, the argument can either go to the direction of this, that the fetus is either not fully human, and therefore it does not have the same rights as the woman bearing it, or it can go in another direction where it says that the fetus is fully human but has no moral claim upon the body of the woman who is bearing it. So there are two different directions you can go here. And when Roe versus Wade was first decided, the pro-choice movement went with number one. And that's when it says that the fetus is not fully human and therefore does not have the same rights as the woman who is bearing it. Now, in fact, it was argued that if the fetus could be classified as a person under the 14th Amendment, then there would be no abortion. And so many pro-life groups have sought to try to invoke personhood as a means of protecting the unborn. That's what the how it was decided in Roe versus Wade. Because at that point, science had not yet developed or come to the conclusion that the child inside of the womb was a person worthy of protection under the 14th Amendment. So that's what it was then. However, as we progress in in medical science, as we now have 3D and 4D ultrasounds, and we can see what the child is doing inside the womb, really science has moved past this and has come out and said, yes, that child is a human being, it's a human life. It cannot be described as anything other than that. The pro-choice movement has then developed their argument or modified their argument a bit to say, okay, we agree that the fetus is fully human, but the thing about it is even though that child is fully human, that child has no right, no claim upon the body of the woman who is bearing it. Probably the most famous illustrations that is given is Judith Jarvis Thomason's what is known as the violinist argument, and I'll let you look that up if you'd like to see a little bit more about it. But as pro-life people have shown or have noted, that argument actually doesn't adequately. It's not an adequate analogy for what happens in childbirth, but that's neither here nor there. We might talk a little bit about that in the forums. But anyway, they say that the fetus is fully human, but has no moral claim upon the body of the woman who is bearing it. And then number 4 for the pro-choice side is that institutions, whether it be the government or religious institutions, etc., no institution has a right to create laws limiting bodily autonomy. So that's the sort of follow-up of the pro-choice side. So on the pro-life side, we have the appeal to the right of the individual to live. On the pro-choice side, we have the appeal to the right of a person to determine what they want to do with their own body. So those are the deontological arguments of the various positions we'll look at. Now, I just want to lay those out there. Because what we're going to do now is I'm going to mention 4 different positions or along the spectrum of pro-life to pro-choice. And the reason that people adopt these positions are going to be different. And what we want to do is measure these different positions against to see whether or not they are consistent with either the pro-life or the pro-choice arguments. So we're going to look at a pro-life position, for example, and say, okay, is that really being consistent with what the pro-life position says? So if you believe in a right to life, is this position consistent? And we're going to look at the pro-choice side, and we're going to say, okay, well, if you believe in the right to bodily autonomy, is this a consistent position, and so on. So we'll do that next. So let's take a look at that. I would like to submit to you that there are at least 4 positions that people can take in relationship to abortion, and they move along a spectrum of very, very pro-life to very, very pro-choice, and they each have their own justifications for whatever it is that they believe. But I'd like to take a look at those now, and starting those off, we're going to start all the way on the most on the furthest on the pro-life side, and we're going to move to the furthest on the pro-choice side. So we'll go ahead and do that. The very furthest, or the most conservative, if you will, of the pro-life positions is what is known as the abolitionist. The abolitionist, and the abolitionist is a group or people of like-minded individuals. The abolitionist is a way of thought that basically believes that abortion should be abolished, and that's why they call themselves abolitionists. Oftentimes they will draw an analogy between slavery and abortion. They'll say, hey, look, during slavery we devalued a whole class of people based on the color of their skin, and then we made laws that allowed us to treat them however we wanted to, up to and including killing them. And then they'll turn around and say, look, with the preborn, with abortion, what we have done is we have created a whole class of people, i.e. the preborn child, and we have devalued them and we have stripped them of their rights so that we can do whatever we want to with them, up to and including killing them. So again, this is the analogy that's been drawn. And so the abolitionist argues, just like we abolished abortion and did away with it as a human rights violation, we also should abolish abortion and do away with it as a human rights violation as well. And the abolitionists, they are on the pro-life side. To give their position sort of as a modification, we would explain it like this. That the abolitionist starts out with the idea that abortion is murder. Abortion is murder, number one. And we've already looked at how the pro-life side justifies that, and they would adopt that same reasoning. Abortion is murder. Number 2, abortion is medically unnecessary. Abortion is medically unnecessary. Now this is quite a surprising claim because there are women who have been harmed up to and including killed by pregnancy, by going through with childbirth. Now that's not, that's relatively rare in the grand scheme of things. More women who get pregnant, give birth, and there may be minor complications, but nothing that can't be taken care of in a medical facility. To actually have a child and or mother die during pregnancy is quite rare in Western in worlds where Western medicine is prevalent, particularly in what is known as the developed world. But still, there are those cases. Few though they may be, there still are those cases, such as an ectopic pregnancy, for example, where or a tubal pregnancy, which is a form of ectopic pregnancy. The tubal pregnancy is where the zygote, instead of traveling down to the uterus and implanting where it should implants in the fallopian tube. And the problem with the zygote implanting into the fallopian tube is that if it does that, it cannot, number one, it can't really get nourishment. Because there's not enough of a blood supply there like there is in the uterus to bring it the nutrients that it needs. And number 2, it's going to grow, if it does get nourishment, it's going to grow to a point where it's going to explode the woman's fallopian tube and cause some major or potentially major internal hemorrhaging. Okay, so that does happen. It's not really altogether common, but it does happen. So what do we do in a case like that? You could bring up others like ovarian cancer that is discovered when a woman is pregnant, or diabetes sometimes can lead to a dangerous pregnancy. So there are other reasons, there are other conditions that would bring this about. So what does one do in those situations? Well, According to the abolitionists, instead of undergoing the abortion, now remember, abortion is where you're forcibly extracting the child piece by piece, but they're dead when they come out, right? Either piece by piece, or you're suctioning out their brain, or you're dismembering them through suction, whatever the case may be, that the abortion intentionally kills the child. Rather than doing that, they would say that's not necessary in any case, even in cases where the pregnancy poses an imminent threat to the health or to the life of the mother. You don't have to go in and chop up the baby. You can always have the mother deliver the baby, even if the baby is premature. Try to save the child, and if the child can't be saved, while that may be a tragedy, it's not the same thing as murder. Basically, what we need to do, says the abolitionist, is we need to treat both the mom and the baby as equals, rather than treating the mom as more important than the baby. They are both human lives. They are equals in that sense, and we should treat them with that respect. And so how this might play out, if a woman has a dangerous pregnancy, and she's not yet far enough along in the pregnancy to deliver a viable child, what you should do is undergo what's known as expectant management. Now, expectant management is where a woman is on bed rest, and she is on observation, medical observation, to where if anything goes wrong, they can know it as soon as it happens and can intervene with medical help so as to ensure that the mother's life is protected. They can deliver the baby, and if it has to happen when the child is severely premature, then they will undergo heroic efforts to save the child as we would any other human being. But if the child cannot be saved, then while it may be tragic, it still is not the same thing as murder. So it's abortion as a procedure is not necessary in any situation, says the abolitionist. Therefore, so abortion is murder. Abortion is medically unnecessary. And the third point that they make is that the law should prohibit abortion, and it should punish abortion as homicide. And you may ask yourself, well, who should it punish it? Who should we punish? Well, according to the abolitionists, you should punish the doctor that is performing the abortion or is attempting to. You should punish the mom who is hired the doctor to perform the abortion, because when we hire somebody to kill someone else, that person goes to jail too, right? You should punish the dad that brings her in and tries to pay for it. You should punish as sort of an accessory to murder. You should punish the people, maybe there's a nurse or an assistant to the physician. You should punish them as well for their role in it. You should even punish the secretary that is fixing the books for the abortionist for their role in it as well, just as if it were somebody hiring out a hit on someone else. So that's what the abolitionist says that we should do as a society. Abortion should be completely abolished, and it should be prosecuted as murder. Those cases where pregnancy endangers the life of the mother, those moms can undergo expectant management, can continue their pregnancy until either the child can be born safely or until it poses a threat to the life of the mother, at which point the child will be delivered. You'll try to work heroic methods on the child to save its life. If that doesn't happen, if the child dies in that course, then while it may be tragic, it does not constitute murder. So abortion in any and every case should be illegal, according to the abolitionist. So that's the furthest on their side of the pro-life side. Now, taking a step back from that, and I know that might sound like a pretty extreme position to many people, even to many pro-life people. But taking a step back from that, if we go back and we look at those pro-life, that pro-life position that we just talked about maybe 15 minutes ago, if we look at those premises that were drawn up there, that human life has intrinsic value, that life should be protected, the abolitionist position is pretty consistent with those things. It may not be, you may not like the position, and it may sound kind of harsh, but at the end of the day, it is consistent. It if indeed this embryo, this child in the uterus has the value of a human life, I mean, we couldn't use a lot of the excuses to end the life of that child in the womb if we treated it as if it were an equal. So anyway, the abolitionist position is pretty consistent with those. Moving on, the next position on the pro-life side is what I call pro-life with exceptions. Pro-life with exceptions. And this view is the one that is held by most people that you would identify as pro-life. National Right to Life and people who follow in that vein. These are people who believe that that they are pro-life, but there may be some exceptions that they would grant in certain cases. And just like there are certain cases where taking of life outside of the womb is justified, so also there may be cases where taking life inside the womb is justified. That's what the pro-life with exceptions would say. But they start off in the same place with the pro-life position. They believe that abortion is murder. In other words, they believe in a right to life, and they believe that abortion violates that right to life. Therefore, abortion is an unjustified homicide. Abortion is murder. Where they go from that, though, is they would say that there are some circumstances where abortion is necessary and or justifiable. That might be still consistent with the pro-life side, because we would say that, generically speaking, for people who are already born, people who are here, and people who can talk to one another and everything, for human beings who have already been born, there are times where taking life, human life, is justified for people who are born. For example, in self-defense, I would hate to ever harm anyone that way, but if someone were trying to harm myself or my children or loved ones, and I, in the process of defending my family, killed that person, I don't think I'd lose a whole lot of sleep over it, because I believe that I would be justified in doing that in order to protect those who are innocent, those who cannot protect themselves. So I think that would be a justifiable homicide. Maybe when police execute when they execute the law enforcement, and that invariably ends up somebody dying, that may be justified. When the military goes into a place and they're fighting, they're shooting each other and people die, that may be justified. And so there may be circumstances just in life in general where it's justifiable to take human life. The pro-life side says, well, there may be some situations where it's justifiable to take the life of a preborn child. Now, there are not many of them, but there may be a few. And let me list at least a few of them. For example, this side would be okay, generally speaking, or this position would be okay with, generally speaking, of abortion in cases where the pregnancy poses a threat to the life of the mother. Now, the abolitionist was not for that at all. The abolitionist said no, abortion should not even be used in those situations. But there are some on the pro-life side who would be willing to allow a case, an exception for cases where the life or the pregnancy itself threatens mom's life. So that's one of the instances in which it may be justifiable for this position. Another instance where ending the life of the child is justifiable for the pro-life with exceptions side is when a child has a condition that is incompatible with life. This is a birth defect that might lead to inherent demise. There are some trisomy diseases that do that. These are genetic diseases or genetic disorders that plague the child. And as long as the child is inside the womb of the mother, it can biologically sustain life. But as soon as the child is born, typically these disorders they'll kill the child within the first few hours of life. I've known a number of these. I've known a number of people who have had these pregnancies, unfortunately, and they do happen, and they're not as infrequent as you might think. There also could be, for example, something like anencephaly. Anencephaly is, for whatever reason, the child's brain doesn't form. and all that really forms is a brain stem, so that controls the bodily functions, but the brain, the rest of the brain doesn't form, and when the child is born, usually the child dies very soon. There's nothing that can be done for it. So those are conditions that are known as incompatible with life. They can be diagnosed sometimes with a fairly good degree of certainty. In those cases, some pro-life with exceptions, they would say, okay, that's a case where abortion should be permissible. And then moving down the list a little bit to number 3 here, there are also cases of rape and incest. Some pro-life people would say that abortion should be allowable if a woman has been raped, because to make a woman, and this is their words, to make a woman go through with this terrible circumstance, and then on top of that have to have a child that has been fathered by her rapist, and she's got to see that child for the rest of her life, and every time she looks at that child, it's going to remind her of that terrible situation that she's gone through. Well, that's just unfair to the child. It's unfair to her because the child's not going to be loved, and she's going to have to relive this for the entirety of her life. And so it's better, and then who knows, maybe because the rapist is the child's father, after he gets out of jail, he might have some sort of visitation rights with the child based on local law, unless they've done something to affect that. So in cases of rape or incest, the mom should be allowed the choice to have an abortion. Now, number 1 and number 2 might be arguably pro-life, because number 1 and number 2 aren't actively going to seek the ending of a life. They're seeking to protect a life. You know, when mom's life is in danger, when the child isn't alive anyway because it has a condition incompatible with life. But number 3, you got to ask yourself if that's really consistent with a pro-life ethic. I mean, we began the discussion by saying, look for a second, because the pro-life side believes that a child has the right to life. Now, if a child is conceived by a rapist, or the child is conceived by a consensual act, makes no difference whatsoever to whether that child should have rights or not. I mean, what child should suffer because their parent was a criminal? So for example, if my father were to be a murderer or something of that nature, why should I suffer? Why should I be put in jail? Why should I suffer his sentence for something that he did? And in the case where a child is conceived by rape, that's essentially what is happening. The child is suffering the death penalty for the crimes of the father who committed the rape. And so one has to wonder if that's really actually consistent with the pro-life position. I don't know that it is, but you know, not everybody's consistent. Well, those are the pro-life sides, the abolitionist and the pro-life with exceptions. Now, we could talk about other exceptions, but any other exceptions really that move beyond that typically fall in the pro-choice category. And so we're going to go back over to the pro-choice pro-choice side of things and look at a few things there. Now, on the other side of the pro-choice, the pro-choice side, this is where a woman has the right to bodily autonomy, the right to do what she wants to with her own body. And that right really trumps all other concerns for the pro-choice person. That right trumps the concerns of the father who may have fathered the child. It trumps the concerns of the fetus in whatever its rights or concerns might be. The woman's right to bodily autonomy, to do what she wants to with her body, supersedes all of those things. Now there are, and really on the most moderate position on the pro-choice side would be somebody who would say, for example, well, I'm morally opposed to abortion. I would never do it, but I would never take away a woman's choice to do what she wants to with her body. Now that may sound very pro-life because the person has a moral issue with abortion, but it really isn't. This is a person, who believes that it may be morally bad to have an abortion, but even the moral badness of abortion doesn't trump the woman's right to do what she wants to with her body. So one might have to question whether that's an entirely consistent argument itself. It seems almost double-minded. However, that is the most moderate position on the pro-choice side. Now, moving down the spectrum a little bit further, there's what is known as the evolving value view. The evolving value view, and this gets a little bit more toward the extreme of the pro-choice side. However, but it says this basically, that as the fetus develops in the womb of its mother, it is going to take on more moral value the more developed it gets. So as it evolves in the womb of the mom, then it's going to be more valuable at later stages, and so the choice of whether to abort or not to abort is going to take on more moral gravity the further along the pregnancy gets. So, for example, the heart beats at 5 weeks, and with that heartbeat, that might be a place where we assign a moral value to that preborn child. And why would that be? Well, because if you were to walk out on your front porch tomorrow morning, and somebody was laid out there and passed out on the front lawn, and they're not moving, and so you say, "Hey, what are you doing?" And they still don't move, they don't twitch, they don't bat an eye. What would you do? What would you likely do? Well, hopefully you'd call somebody, the police or paramedics or somebody. But wait, how would they tell if that person is alive? Well, they would take the person's pulse. That's the first thing that they would do. They'd check for breathing, check for pulse. And why is that? Well, because the heartbeat is the first sign of life that a person looks for. So a preborn child with a heartbeat then is a preborn child that's alive. There have been many, they're generally called pro-life bills, but they're called heartbeat bills that have been circulated in recent years. But these pro-life heartbeat bills really are part of this evolving value view. They really buy into that, which is not actually a pro-life justification. But they would say, okay, once we can detect a heartbeat, then that child is alive, then that child should be allowed to live. Well, the next stage would be quickening. Quickening is when the mom feels the baby move inside of her. And you have to admit that, at least, if you had been pregnant or with child, and you felt the child moving inside of you, you have to admit that would do something psychologically, right? Because before that, maybe you were getting sick, maybe you had some morning sickness. What's going on now is real, because you know that there's something moving in there. You know that child is alive, and so that sort of changes things psychologically. The next stage would be that of sentience, the ability to feel pain. And as the child grows and develops, it begins to be able to feel pain and interact with the environment around it. It would be morally repugnant, some would say, to have an abortion on a child that can feel it. Especially understanding what abortion does to the physiology or the body of a child, when it, being ripped limb from limb at that stage. If the child is sentient and the child can feel it, it would be horrific to think that you would do that to another living human being. And so some would say, and there have been legislation attempted to be passed that forces abortion doctors who are performing abortions after 20 weeks to anesthetize the fetus so that the fetus does not feel pain. Some of that's been met with some resistance. And then there's viability. Once a child attains the ability to live on its own, then one has to ask, well, why don't you just deliver the child and let the child live? Why go through with the abortion? And so it almost becomes like infanticide at that point. And then there's birth. And when a child is born, they're protected under law right now. As long as they're healthy and viable, they're protected under law. But there are some now who are advocating the view that a parent should have the ability to choose whether or not they should abort. They want to abort the child, even to a point after the child has been born. That might seem a little bit shocking to some, but that view is out there, and it's being discussed. It is. But as the child, basically the evolving value view says, as the child develops, it gains more moral value the further along in the pregnancy that it gets. It evolves that value. And then the last position, the most extreme position on the pro-choice side that we'll look at, is that of the feminist position on abortion. The feminist position requires a little bit of reconsideration because they do agree with a woman's right to bodily autonomy, but they take it another step further. And what they say is that a woman, they start out with their position with a woman has the right to be equal to a man. A woman has the right to be equal to a man. Not only do they have the right to bodily autonomy, but they have the right to be equal to a man. So what is it going to take for us to do to ensure that a woman has equality with a man? Well, if you go back and you remember what is a right? What is a right? A right is a claim on others that you have on others that includes a freedom or liberty for yourself. And if the woman has a right to be equal to a man, then what that means is that she has a claim on everybody else in society to be equal to every other man in society. That's a claim, and if we need to ensure that as the rest of society. Now, one source of inequality between the woman and the man is the fact that women can bear children. Now, why is that a source of inequality? Why is that a source of inequality? Because if a woman cannot control her reproductive system or her reproductive choices, then she is the one who is going to be most immediately impacted whenever a child comes along, whenever a pregnancy occurs. You see, the man can still go out, he can still do everything that he could do before, whereas a woman, when she gets pregnant, is going to, over the period of 9 months or so, beginning sometimes very, very immediately, but over a period of 9 months or so, is going to be progressively more inhibited or prohibited from doing things just by virtue of her condition. And so as the months progress, she's going to be able to do less and less. Now think about this. Think if you're an HR person and you're deciding who to hire for this particular upper management position in a company, and you've got two candidates that are in front of you who are entirely equal. They have great education, they've got great references, they've got great work experience, they seem to be very, very ambitious, very ready to do the job. One of them is a man and one of them is a woman. All other things are pretty much equal. Which one are you most likely to choose and why? Well, the feminist argues that the woman usually is the one who gets the short end of the stick there. Why? Well, the feminist would say, because here's what happens. The person who's hiring for HR knows that there'll come a time where this woman will probably be pregnant. And if the woman, if she gets pregnant, she's going to have sick days probably during the course of her pregnancy. She's going to be limited in what she can do. She's not going to be able to do the things that she used to be able to do. And after she has the child, then she's going to have 12 weeks where the government is guaranteed that she'll be off work. And she's going to have those 12 weeks off of work. And in that time, we're going to have to get the same work done, but we can't hire somebody else for her job. And then when she comes back from that work, then she's going to have a child to take care of. And so anytime that her child care provider is sick or can't do what they can't take care of the children, she's going to have to call off work. Every time that that the child is sick and can't go to school, she's going to have to call off work. So there's going to be fewer work days. Her interests are going to be divided. Whereas the man, what happens when the man decides to start having children? Well, when the man starts having children, it doesn't affect him physically. He can still do the same kind of work that he used to do. In fact, he might even be motivated because we got this kid coming along and he wants to make sure that the family has everything that they need to make ends meet. He might even be more motivated to do more work then. And when the kid's born, he's got to come. He might have a couple of weeks off, but he's coming right back to work and he's going to get right back at it. And he's going to be more motivated because of the additional responsibilities he has to care for his family. He's going to be more motivated to do those things, and he can do that because it doesn't immediately involve him or his body. Now, the feminist says, look, see here, this is a source of terrible inequality between men and women, and so what we need to do as a society is to ensure that the woman does not suffer this sort of fate. And the only way to do that is to put the woman in full charge of her ability to reproduce, which means that we as a society need to ensure that the woman has access to birth control. In fact, most feminists would say that the woman has a right to subsidized birth control. In other words, she shouldn't even have to pay for it. Birth control should be a subsidized right. And not only that, but abortion also, for those on the more extreme side of the feminist position, abortion also should be a human right, guaranteed, abortion on demand without apology. We should set up drive-thrus that allow a woman to do this sort of thing, right? Now, that's being hyperbolic, of course. But this is the position of the feminist who would say, unless and until a woman has the ability full bore to control her reproductive choices, she will never be equal with a man. Therefore, society, because she has a right to be equal with a man, society owes it to her to be able to be equal to a man. Therefore, abortion and access to birth control should be unrestricted. So that is the feminist position. So we've moved from the abolitionist to the feminist. And that's sort of where we end. But before we do, let's ask a few questions, right? These are always good thought-provoking questions. Number one, the first question that I'll ask is the fetus growing in the woman's womb a human life that deserved legal rights and protection? It seems that is the overarching question. Is the child a human being, a human life worthy of protection? Because depending upon our answer there, that really decides the morality of abortion. Because if so, if the child inside of the woman is a human life, then we as a society have a duty to protect that child. We have a duty to protect it. If it's a human life that is worthy of protection, then we have the obligation to protect that child. If not, then there are a couple questions that follow that, right? So if this is not a human life that deserves legal rights and protection, if not, then when exactly do humans first get the legal rights and protection? When do we get it? Do we get it at heartbeat? Do we get it at quickening? Do we get it at sentience? Do we get it at viability? Do we get it at birth, or sometimes after birth? Where is it? Where do we get it? Why? Whatever point we choose there, why is that the place that we get it? And then who gets to decide that's when we get it and when we don't? Does the government get to decide? Do religious people get to decide? Do individuals get to decide, and so forth? So that's the first sort of major question, and then some follow-ups. After that, the other major question that I would have is this: is bodily autonomy absolute? In other words, does a woman have the absolute duty to do whatever she wants to with her body? Now, if this is the case, if people have an absolute right to bodily autonomy, then we have to ask ourselves, how in the world do we ever make any laws? Because the function of any and every law is to limit what we do with our body. For example, speed limit laws say that I cannot take my body and I can't get in my car and drive my body down the road in my car at excessive speeds. Those laws basically limit what we can do with our bodies. Every law does. Laws against rape limit what the rapist can do with his body. I mean, the rapist has the ability to go and rape a woman. Why should he not? Well, he shouldn't do it because what it does is that violates the rights of another human being. And if the child in the womb is a human being, then exercising the woman exercising her bodily autonomy to harm the body of the child is no different, because what the rapist is doing is exercising his bodily autonomy to violate a woman, assuming it's a man raping a woman. So is bodily autonomy absolute? It seems like it would be an absurd thing to say that it is. There are times where the law should limit what we do with our bodies. In those times, in particular, are times where what we do with our body harms another person. Now, if bodily autonomy is not absolute, then what is the principle to tell when it applies? What is the principle to tell when it applies? Now, normally, among people who are already born, The principle is, if our exercise of our bodily autonomy brings harm or could potentially bring harm in some cases to another, then we should exercise restraint in what we do with our body. But how does that apply to the preborn child? So those are some questions on the issue of abortion to go along with, I guess, a rather lengthy explanation of all of the issues and the positions involved with that. That does it for this video. We'll see you next time, and when we get on to another issue. Have a great one.